Today we will learn how to concise a bacteriology in one page. Today we will learn a gram-positive bacteria composed of gram-positive cocci, bacilli. First learn cocci. C. All the taste of cocci composed of C. Okay. Then first catalase taste. Catalase test positive Staphylococcus, negative Streptococcus, Staphylococcus in clusters, Streptococcus in chain. Then continue with Staphylococcus. Second test, coagulase test. How will you remember that which test come earlier? That is the catalase test. We will go through the alphabetical order like C and A. A comes first and O later. So first, according to the catalase test, positive Staphylococcus. How will we remember that catalase test positive is Staphylo, not Strepto? Just remember one thing. We have a cat and her name is Staffy. Catty, Staffy. Catty, Staffy. Catalase test positive, Staffy. Staphylococcus, catalase positives in clusters. And then according to the coagulase test, if coagulase test positive, Staph aureus. That means Staph aureus is coagulase test positive as well as catalase test positive. Another group is coagulase negative Staphylococcus. N for negative, N for novobasin sensitivity. According to novobasin sensitivity, if sensitive, then it is Staph epidermidis. How will we recognize that this is the question of Staph epidermidis? Epidermis, a layer of skin. Then in question, there will be history of skin catheter or any hospital admission or any IV line treatment. Next, resistance. If novobasin resistance, this is the Staph saprophyticus. Staph epidermidis. SS, novobasin sensitive, SS, saprophyticus, RR, resistance, novobasin resistance is the saprophyticus, history of any UTI. Then my next group is Streptococcus. This is a gram-positive bacteria, foci, catalase test negative, and in chain. The first classification according to the Brown's classification based on hemolysis in blood agar. If there is partial hemolysis, then categorized under alpha hemolysis, and two bacteria comes in Streptoviridans and Streptococcus pneumoniae, very famous name of bacteria in our medical terminology. So, how will differentiate viridans and Streptococcus pneumoniae according to the Cullen reaction, bile solubility, optocene sensitivity, and the inulin fermentation. Everything is positive in Streptococcus pneumoniae and absent in Streptococcus viridans. Very simple. Then next is gamma hemolysis, means no hemolysis is occur, and only one bacteria, Enterococcus. Most important gram-positive cocci for hospital-acquired infection and UTI. Two important things, grow in 6.5% salt and 42 degrees centigrade temperature, 40% bile and 9.6 pH. Usually bacteria grow on a neutral pH, but some exceptions are there which is very important. We will study later, and one important Enterococcus grow in 9.6 pH. And next important, beta hemolysis. Undergo complete hemolysis. Carbohydrate, according to the carbohydrate in the cell wall, we classify Lancefield classification. So in case of Streptococcus, we study two classification. First is Brown's classification, BH, B for H. Brown's classification based on hemolysis in blood agar, and Lancefield classification LC, Lancephil CC based on carbohydrate in the cell wall. Total 21 types, but two group is very important, group A and group B. Group B Streptococcus pyogen, group B Streptococcus azelactii. And so this is the overall classification of gram-positive cocci, Staphylococcus and Streptococcus, two broad term. And under this group, Staphylococcus, according to the two tests, that is the coagulase test and Novovaccine sensitivity, Staphylococcus having Staph aureus and coagulase negative Staph. Then according to Novovaccine sensitivity, Staph epidermidis, Staph saprophyticus, and then Streptococcus according to the hemolysis, alpha, beta and gamma. Alpha Streptococcus viridans, Streptococcus pneumoniae. Then gamma hemolysis, no hemolysis, Enterococcus, beta hemolysis, complete hemolysis. And according to the carbohydrate in the cell wall, 21 type of the classification of Lancephil classification, group A and group B, which is a very important, we will study further. So this is the gram-positive cocci, and now study gram-positive bacilli. So gram-positive bacilli is divided according to the spore. If spore is there, and then classify further according to the oxygen requirement. If oxygen requirement is there, aerobic and Bacillus, Bacillus anthracis and Bacillus cereus. Anthracis, concentrate on N. So everything composed of N. N means Bacillus anthracis is non-motile, aerobic, spore forming, non-hemolytic, non-bulging spore. Non-bulging spore, non-hemolytic, non-motile, aerobic, spore forming Bacillus anthracis. Next, Bacillus cereus, CC. Chinese fried rice poisoning usually cause, and it is a motile and hemolytic. Bacillus cereus, motile, hemolytic, Chinese fried rice poisoning, and aerobic, spore forming. Then spore forming anaerobic bacilli, Clostridium. Under these four different bacteria, Clostridium tetani, name itself says it's caused tetanus, wound infection. Clostridium difficile itself says it is a difficult in cultivation and most important antibiotic associated pseudomembrane enterocolitis. Then Clostridium botulinum, bottle, it cause poisoning, any bottle like poison, can poisoning, food poisoning, different type of poisoning, infant poisoning, in which it cause paralysis, flaccid paralysis. Then Clostridium perfringens, it cause gas gangrene, myonecrosis, necrotizing fasciitis, enterocolitis. An important thing that you remember, in Clostridium, every bacteria is anaerobic except Clostridium perfringens. Itself a per, but means it will not follow all. Per, question mark itself, per, question mark. Okay, so all Clostridium anaerobic except Clostridium perfringens, it is aerotolerant. Clostridium, all Clostridium are capsulated except Clostridium perfringens, all Clostridium motile except Clostridium perfringens. So next is, this is the example of gram-positive bacilli, spore forming, positive according to the oxygen requirement, aerobic, anaerobic. Then non-spore forming, aerobic and anaerobic. Non-spore forming anaerobic is only one group, Actinomycetes bacteria, and aerobic is Corynebacterium, Nocardia, Listeria, Mycobacteria. How will you remember the gram-positive bacilli having no spore and aerobic is mnemonic is Lisa says no AC. Mycobacterium, Lisa, Listeria, no Nocardia, AC, A for aerobic, C for Corynebacterium. So this is the example of So this is the simple mind map of all the gram positive bacteria, either cocci or bacilli. It's a very simple, and you can make and remember. It will help you. Thank you.